I will speak in English so that it's easier for our international guests to follow my presentation. I will give a small talk on denial of pregnancy. This is not probably the best way of calling this phenomenon, the denial of pregnancy. And it is, although it's very frequent, it is largely ignored, or sometimes it makes the headlines in the journals or the television. So it's interesting to talk about this most unexpected pregnancy. This is my credentials. These are my credentials. I work in a perinatal psychiatry unit. I work in a very small place. It is up there, as you can see. Well, no, that was a joke. That's where I work. And as our moderator said, I work in perinatal psychiatry for many years now. And I can ask you, what is exactly perinatal psychiatry? Well, you can answer, it is the psychiatrist dealing with pregnant women or postnatal women. In fact, perinatal psychiatry is a very militant, activist branch of psychiatry. We work in perinatal psychiatry because we are convinced that women, even in the most richest countries in the West, do not get appropriate care, psychological care, when they need it. So we are, several of us in the world and also in Turkey, are working to get better care for these women. Perinatal depression, postnatal psychosis, all these issues are waiting for efficient solutions in the world and also in the developing world. I have several affiliations, just to tell you that these people, the scientific associations, and also in red, the Postpartum Support International, with women with lived experience, patients, mothers, who work to better the care for these women. On this slide, you also see another association that you do not know. It is in French. I will be talking about this association and all the work that they have done for the recognition of denial of pregnancy. This is AFRDG. I'll say that in French later on. Just before presenting you a case and then several considerations, what is our aspiration as a psychiatrist, as a doctor or psychologist? What are we trying to do? I think we above all, we need solid science, not a pseudoscience, not something which is not science, solid data. And also we want human warmth, connection and understanding. We don't want to be cut off from our patients with some pseudoscientific considerations or not knowing. And I think denial of pregnancy is really a very specific topic. I don't know if you know the word touchstone in English. Touchstone is the stone, a very specific stone which is used to know if a metal is gold or not. I mean, you just scratch the thing and you know what the worth of the thing is. Or I also put you the litmus paper. Denial of pregnancy is something which gives information on the professional on how he is thinking, how solid his scientific base is, and how connected he or she is to his patients. What I mean is that I can say, tell me what you think about denial of pregnancy and I'll tell you who you are. And we largely ignore what denial of pregnancy is. Let me say a few words. This is once again the place that I work. Let me say a few words about a patient that I have met in 2009. That was a pregnant patient, and when the midwife who was called to take care of this patient called me, she said, I need your help, Oğuz. I don't know how to deal with that patient. I said, what's so special about this patient? In fact, this was a lady who was expecting her first child who were to live, but she had lost 4 babies. She had killed 4 babies, which were found in a deep freezer, and in fact, she had just got out of prison and awaiting for trial. This is really how I met denial of pregnancy, and I followed this patient for 2 years up to her, she gave birth to her son, and afterwards she awaited the trial and she got a prison sentence. During a very detailed follow-up, I really saw that this patient, this is just one patient, did not have any psychiatric disorder. She was not psychotic. She had a very broken family history, of course, and a broken couple history. And it is when she tried to leave that first husband, just trying to leave the husband, that she herself undiscovered the babies without knowing it, who were in the deep freezer. Anyway, just to tell you that these tragic cases, they are not isolated. The French Association for the Recognition of Denial of Pregnancy, that's the association, has done a lot in France so that these cases can be counted, put together in a file, these people contacted, the families get help, can contact each other and so on. We owe a lot to Felix Navarro, who was the founder with a group of people of this association. They're doing patient advocacy. In France, well, France has been a leading place for many things in the past, but nowadays we're not that good, maybe not on every topic. But on this topic, I think France has been really leading the opinion in the world and bringing some kind of awareness on pregnancy denial. These people have organized the first Congress in the world on denial of pregnancy, and they invited Jens Wessel and Christoph Brzezinka. I'll say a few words about these pioneers. And afterwards, we regularly have congresses on pregnancy denial in France now, thanks to the activist group. And also thanks to the Marseille group, Marseille French group and the IFRDG. We also had a plenary talk in the Marseille Society International Conference on this topic, really raising awareness about this. Let me say a few words about the research, several publications on this topic. Christoph Brzezinka is a gynecologist who is a teacher in a local midwifery school. He basically teaches midwives. Over 20 years, he has collected many cases of total denial of pregnancy. He has done one of the most important publications in 1994, 27 women, total denial of pregnancy, near total denial of pregnancy, and studied the background of these women. Here is Christoph Brzezinka, very lovely, friendly man. And the second person, Jens Wessel, has done the first, maybe the best, epidemiological study on the issue. Jens was doing his thesis on gynecology. He's an obstetrician in Berlin, and he collected a large data prospectively and studied the cases of partial and total denials in Berlin. Here's Jens Wessel. I'll go fast on that. Basically, he collected information on every birth in the Berlin metropolitan area during 1 year and a half. This was each time that a woman discovered that she was pregnant after 20 weeks of gestation, he was called and he interviewed these women personally. It was roughly 30,000 deliveries. And he found something like 90 women whose pregnancies were discovered after 20th week of gestation. And 2/3 of these women, nearly 60, had denial of pregnancy. What is interesting, so roughly let me pass on that. What Jens Wessel's study shows us is that the frequency or prevalence of partial denial, a woman realizing that she's pregnant after 20th week of gestation, is 1 in 500. 1 in 500. That means 2 in 1,000. It's two times more frequent than psychosis, puerperal psychosis. The total denial is 1 in 2,500. That means total denial when a woman realizes that she has given birth when she sees the baby, not even during labor. See what I mean? One of the most important discoveries of these two studies and later minor studies who have come to complete these studies are that there are no specific profiles of these women. Any woman can be a victim of pregnancy denial. You may note that I'm not saying any woman can deny her pregnancy. I don't like that word. Women are victims of denial of pregnancy. 80% were in a stable relationship. 50% already had a child, any age. There were women 45 years old thinking that they were going through menopause. There were younger ladies. They were of every social origin, every profession. They were not adolescents, immature, psychotic, or whatsoever. And you may know that, but it's very important. In other series, we know that a woman who presents a pregnancy denial, 1 in 2 women had already another pregnancy denial in the past. So this is something which reoccurs. I think the pregnancy denial, this term denial has psychoanalytic connotations and so on. This is not a good word. This is a woman's lack of awareness of being pregnant. This is not concealed pregnancy. This is not a woman hiding her pregnancy. And this is not, I'm saying this for the psychiatrists here because I suppose there are many psychiatrists, this is not a psychotic woman who is unaware of her pregnancy, whereas everybody around is aware that she's pregnant. That is not classical pregnancy denial. Psychiatric disorders are very rare in pregnancy denial series. Real pregnancy denial, or the real thing, is that the pregnancy is not noticed, neither by the patient nor by others. And who are these others? Close family members, the partner. The couple may have sexual intercourse till the end, just before the birth is given. Doctors. In Jens' series, 30% of the women consulted a doctor a month before the baby was born. The total denials. Prison. Why am I saying prison? We have women who have been in prison because of infanticide, and they have given birth in prison. Nobody realized that they were once again pregnant when they were just going into prison. I'm saying television because we had in France a woman who was on television, something like The Voice, a voice contest, and she was on the screens for many weeks and so on, and she was pregnant. She gave birth after a total denial of pregnancy. And we also have a patient who went to a nudist camp. She was basically totally naked just before giving birth with total denial. So this denial is shared. And probably a better word, that's what Jens Wessel used in his original thesis in German, if you read German, die nicht wahrgenommene Schwangerschaft. That means basically the unperceived pregnancy. Grossesse non perçue, in French, if you like. I don't know how you would say it in Turkish. I think the clinical experience shows us that any woman at the age of procreation should be considered pregnant unless proved otherwise. That's what the doctors used to say in France last century, I've been told. My idea is that any woman should herself consider herself pregnant unless proved otherwise. I seem to think as a clinician that when a woman thinks that she cannot be pregnant, then she's at risk of pregnancy denial. Sometimes she thinks she cannot be pregnant because she is in such an abusive environment that she cannot think of a pregnancy. Sometimes she is overworked. We have an obstetrician, professor of obstetrics, who was operating with one of her assistants, interns, and the lady obstetrician herself gave birth with total pregnancy denial the day after. Or there are also people waiting for infertility treatment and have pregnancy denials. They're so convinced that they cannot be pregnant. What are the consequences, just to summarize? There are, of course, many consequences with total denials, of course, but even partial denial means that you did not have the follow-up. Consequences are obstetrical, pediatric, and so on, psychologic, but the most important consequences may be stigma, is that if it's that frequent, why don't we know people who can talk about their experiences? If you really talk in your environment, you will discover several people who have experienced it directly. That has been my case anyway. So we must lift that stigma. We must talk about pregnancy denial scientifically. And there are also tragic consequences, death of the baby, of course, and legal consequences. So if we look at these tragic consequences, let me remind you, 1 in 2,500 births are diagnosis postpartum. That means the lady realizes that she was pregnant when the baby is there, not during the contractions. And 1 in 4 of these births can be at home. If she thinks that she has pain, she goes to the emergency department and she realizes she was pregnant. If it's at home, if there's somebody beside her, then she might not get disconnected from reality. If she is alone, just imagine what kind of pain you're going through. You do not know that you're pregnant and what the consequences of such an experience can be. This is derealization, something like a dissociative state probably. And the woman presents unpredictable behavior. She might just as well shower the baby out of the room, or put the baby in the freezer or elsewhere, and so on. In France, one estimate is that there are probably 2,400 denials per year, 300 total denials, 1 to 15 newborns dying every year, probably 7 natural deaths because the mother is not able to care for the baby. She's not in reality, but she does not do anything to the baby. And maybe 7 deaths when the woman does something to the baby, which is considered a neonaticide.
We have 2 more minutes.
Thank you. We, of course, have legal and ethical issues on these. There's a recent publication. We do not have that many publications, unfortunately, on pregnancy denial. This article is interesting, but it still has some flaws, mixing some... And we do need more research. In Turkey, I'm very proud to know that after the Marseille conference, Nazan Aydın, as usual, has undertaken with Hatice research on pregnancy denial. She might, during the discussion, tell us about the results. It has not yet been published, Nazan. So we do need solid science. I think here we have a phenomenon which can be described, neatly described, researched in an epidemiological way. And we do need human warmth and connection. We don't need to judge these people without knowing what's going on. So that was my message concerning pregnancy denial. Thank you for your attention.